Hi, I'm Lauren Sonnenberg with LifeCore, and welcome to this Thursday's edition of Mind Body Talk on chronic pain. So thank you for joining me, and if you're just chiming in now, just send a little like to say hello, let us know where you're from, let us know what brought you here, and listening in and tuning in to our talk today, which is on 4 reasons you need mind-body medicine if you have chronic pain. Now, the second part of that title, which was unspoken thus far, should be something like this. 4 reasons you need mind-body medicine if you have chronic pain and you don't want to feel the same way you do or worse in a year from now. That's how powerful mind-body medicine is. And mind-body medicine can be defined broadly. In short, the mind-body medicine I'm using in my practice is a combination of EFT, emotional freedom techniques, also known as tapping, or emotional acupressure, or acupressure desensitization, the more technical term. A combination of that with psychotherapy, some talk therapy, and some mindfulness techniques and affirmations where appropriate. Because I don't think it's helpful always to affirm something that you really don't believe, because then you're just strengthening it. But that's another topic for another day. So the 4 reasons that you need mind-body medicine. Number 1, mind-body medicine will get to the root cause of why you're having pain show up chronically. And just like if somebody were really, really sick because they had ingested a foreign object and the body was not liking it and it wasn't getting rid of it, you wouldn't want to just give them antibiotics. You'd want to remove the object if it wasn't moving through. That's a root cause. You want to remove the root cause versus just topically giving a medication, for example. And I'm not here to say, because I'm not a medical doctor, LifeCore is not a medical practice, I'm not here to tell you what medications to take or not to take. I'm just saying that certain approaches aren't necessarily getting to the root cause of the issue. And so I suppose among the camps out there that talk about how to address pain, there may be some argument about what is actually the root cause. And I understand that there are lots of perspectives on this. When you look at the science of German New Medicine, which I've spoken about before, and I'll continue to speak about and thread it through our discussions because it is so important of a topic, we do see that the biological conflicts, which are also emotional, so I call them bioemotional conflicts, show up. When they are activated, they create a response in the body, and German New Medicine identifies a 2-phase response for every disease, or as they call it, special biologically significant response of the body. Okay. And now what happens is when you start to resolve that conflict, you're going to have a different set of symptoms. And a lot of times we'll see the pain in the healing phase, the second phase after the conflict activity. There are some instances where you'll see pain in the conflict active phase. Not as common in chronic pain, but it does occur. But there's a way to address that all. All of that is being said right now to say, when you know that science, you see the emotional root causes, or bioemotional, in fact, and then you see the physical response and the functional response of the body. So when we understand that science, we can really see why it is so important to address chronic pain from a mind-body medicine approach. That doesn't mean throw everything else out. There are some conventional approaches, and there are some alternative or holistic or integrative approaches that you're not going to just want to throw out during the treatment of chronic pain. When we look at an integrative or collective plan that is pulling the best possible approaches from different modalities, we're going to have a very effective means to help a person go from having chronic pain to having control over that chronic pain and feeling less and less of those symptoms over the course of time. And there's nobody with chronic pain who doesn't want that. So that's the first part. Mind-body medicine gets to the root and cause of the cycle that creates the pain. Now, number two, what mind-body medicine does not do, and this is essential, is that it does not suppress or slow down the body's natural healing response. This is huge. This is huge because, unfortunately, unless a person knows the science of German New Medicine and understands the two phases, you don't know then which certain medications or treatments will actually make or exacerbate certain symptoms in certain phases. This is why it's imperative that, and I encourage any medical practitioner who's treating chronic pain to familiarize themselves with German New Medicine. I mean, this gives you the keys to the kingdom of understanding what medications will actually make certain symptoms worse, which will slow the body down, when you'd want to use it, when you wouldn't want to use it. Even if it's absolutely imperative that you have to use a medication when it's slowing the body's natural response down, just because sometimes a person just can't take the pain, that's okay. But let's make sure we're using this in a strategic method informed by the science of German New Medicine. So there's so much power in there. There's so much we can do to help people with chronic pain to feel better. So number three, it just makes sense to do something that'll work faster than slower. We know that the common treatments out there, on the whole, aren't really wiping out chronic pain, because we still have millions and millions of people in the US alone and in other countries across the world, everywhere really, that have chronic pain. And it would be a success of our generation if we were able to really put a dent in those numbers. So what we have to do is use something that's going to work faster. Now, it doesn't have to work overnight, and actually we probably wouldn't want a lot of these things to just heal up overnight. Or maybe it sounds like you would want them to, but the body needs time to be able to respond and heal, and the mind needs time to adjust and put a new thinking cap on, a new way of viewing pain, understanding the science, but then also understanding the psychological pieces, the emotional pieces that are so crucial to how we view the pain, how we respond to the pain, our relationship with the pain. When we see the pain as, oh my gosh, this awful thing, and I have to get away from it, I have to stop it, I have to kill it, I have to get rid of it. And there's that disempowered feeling that goes along with that. That's not going to be very helpful for a person who wants to feel better, and everybody wants to feel better. So we need to give people mindsets that empower them, that are in alignment with mind-body medicine, that are in alignment with strengthening, healing, moving forward, letting the body repair. And if you're going for a treatment and a person says you're always going to have this, and it's going to be this bad or worse, that's not going to be empowering. So we have to make sure that we're letting our patients, clients, and peers know with chronic pain that there is a better way. There is a way that is going to bring about relief. It may take a little, it might not take overnight. It might be 6 sessions. It might be a year. For some people, it might be longer than that, but it's better than having the same level of pain or worse for the rest of your life. So it's not a magical wand cure for people, but it makes logical sense because it's faster in most cases than the other treatments on the whole, which are managing the ups and downs versus actually providing a means to really resolve the root cause of the pain. And this brings me to number 4. It doesn't matter if we're talking about pain here or really anything that any disease a person is living with and working through, especially ones that are showing up in a more chronic fashion. If we just had a magic wand or a magic, pill that just made everything better, we would miss one thing. And sure, the short-term benefits of that, of magically feeling better and having no more symptoms, sound appealing. Of course they do. But unless you've actually gone through a mind-body medicine course of treatment and you're healing according to those perspectives and along that path, what you see then, and I guess I can tell you this, you might not believe it until you actually are in it, because there's nothing like true experience, your own experience versus somebody else's. Even somebody else's experience, which is powerful, is more powerful than me even telling you about it. But the best possible experience is your own. When you experience this and you realize that a mind-body medicine approach to healing is actually psychologically and in many cases, psychospiritually transformative. Now, what does that mean? It means that if I am on this pathway, for example, of working through fibromyalgia, and I realize that there is, you've heard me speak a little bit about self-devaluation conflicts, feeling not worthy enough, not strong enough, not good enough, feeling put down by others. There are a whole slew of emotions and emotional conflicts that would fall under that self-devaluation conflict umbrella. And once you are able to see the cycle that's going on in your life, and when you start to heal this on an emotional level, what happens is, yes, that part's healing. Your physical response is going to occur too. And that doesn't mean that you never have a moment where it gets a little worse before it gets better, because it's part of the healing process oftentimes. Because the pain, as you might have heard in my other talks, is actually, in many cases, a sign of the healing. Because it's the increased blood flow, the swelling, the increased blood flow to bring nutrients to rebuild and strengthen that area, the swelling, the inflammation, all of that's occurring. And so pain is a good sign. In many, many cases, pain is a good sign. Like I said, there are some exceptions where that isn't a sign of the healing phase, but don't get hung up on that. We'll cross that bridge in another talk. Don't worry about that. Don't say, oh my goodness, what if my pain is not a healing sign? We'll have no fear. We'll cross that bridge. But back to my 4th point here, the psychospiritual transformation. So you're healing the mind, you're healing the body, and not only are you healing your mind, say on that self-devaluation topic, and you're starting to feel a sense of greater worth, but what does that happen? How does that show up as a transformation in your life? Not just feeling better about yourself, but that opens doors then. Without fail. I don't think I've ever worked with a person where they weren't healing some of these other emotional issues, and then they say, you know what, I've been meaning to do this, maybe go back to school or start a business or go back to work part-time or have a child or travel the world or whatever it is. It could be, maybe it's not something that seemingly is that big on paper, but whatever is meaningful to you that you have not been doing, not necessarily just because of your pain, but because of the chronic emotional tape that you were playing in your head. I'm not worthy, I'm not good enough, I can't do this, I'm not going to be able to, I won't be able to finish it. Whatever that chronic tape is, those tapes, that self-talk gets addressed in mind-body medicine. And that's powerful. So let's recap. And if you have any questions, go ahead and type them in. Let me know, because I'm largely at the end of what I wanted to focus on today. And so I'd be happy to answer any questions that people have. So again, just to recap, the 4 reasons you need mind-body medicine for chronic pain if you want to feel better than you do right now in a year from now and not worse, okay? And who doesn't, is it gets to the root cause of the pain. And just a reminder for those people who may be new to this whole concept, it does not mean that there's not an actual physical manifestation that you're feeling just because we attribute the root cause to an emotional or a bio-emotional conflict. That bio-emotional conflict gives rise to an actual measurable physical response you can actually even see on a brain scan. So don't let anyone tell you, oh, it's all in your head. It's real. The pain is real. It absolutely is. But we're getting to the root cause of it, so you don't have to be stuck in this cycle forever. Number 2, a mind-body medicine approach does not slow down or suppress the body's natural healing responses like some treatments could do. And I don't say that to scare you. I just say that to say that there are things that are important to look at so that we're not slowing down the body. We want to allow the body to heal and not get in the way of it. The third one is it makes logical sense because it's a faster approach, even though it's not an overnight approach generally. There are some cases, but that's more of a rarity. But it's faster than just managing something for the rest of your life and watching it kind of stay the same or get worse. Nobody wants that. And the fourth, very powerful reason why is that it brings psychospiritual transformation to your life. So it's not just dealing with the bio-emotional conflict, and that is powerful in and of itself. It's not just having the physical transformation, that's great, but it's how does your life change after you go through all of this? Not just, I can start to do things that I couldn't do before, and I kind of have my life back. That's great. That's huge. But even beyond that, it becomes liberating because all of these things that were holding you back in certain areas of your life, these doors start to pop open. Not all at once, generally, but they start to pop open. And so this is a whole person approach. Mind, body, spirit. So thank you so much for joining me today. If you have any questions, definitely let me know. And otherwise, I will definitely look forward to seeing you again next Thursday, 2 p.m. Eastern, for another mind-body talk on chronic pain. Thanks again. Take care. And if you haven't checked out the mind-body empowerment group for chronic pain, I'm going to put the link in this post in just a short bit. And so it's a free group to join, and it starts to expose you to mind-body medicine approaches and approaches that get you empowered to deal with your chronic pain. Thanks again for joining me, and we'll see you next week. Bye-bye.